partially come out of lockdown,
Yes.
and there's an awful lot of talk about where it now goes. There's talk about the rise in positive cases of COVID. What do you feel about this, Andrew, with what's happening? And there's lots of sort of things that have been linked to the media as well, with apparently what's going to come out next week, which is very difficult for you to comment on. What do you feel about the situation at the moment?
Well, I think we should be very anxious about the increase in the number of positive cases. We know that the increase in positive cases earlier in the year led to an increase in hospitalisations and then deaths. We haven't yet seen that, but we might be on the same trajectory, the same projection. So I think we need to be anxious, and therefore this is a moment that is really quite a serious one. We know that the data is also quite significant, and it moves quickly. So only a few weeks ago, the number of people per 100,000 in our area that was infected was around 20. Now it's around 80. And in some parts of the north, it's over 500 and approaching 700. So this is moving very, very quickly. That means it is hard in terms of the authorities, both local and national, to respond. But it also means that we as individuals can play a role to help prevent the spread. And we know what to do. It's a quite straightforward matter. It's the hands, face, space message. And that's the best thing that we have been told by the chief medical officers that we can do to help.
With the statistics, we've kind of the discussion's moved on from the number of deaths to the number of cases. And obviously if you test more, you'll find more cases. Have you a feel for how much more testing has actually gone on in North Yorkshire or the Harrogate region itself?
Yes, testing's gone through the roof. Testing has increased 100-fold pretty much since the very earliest days of this pandemic. And yes, there are lots of tests, and we're going to have a permanent test site here in Harrogate. Most of the tests at the moment are being done through either the mobile test units or the permanent one that's been out at York, or in the home testing arena. But basically we need to not just look at the number of tests, we need to look at the number of tests and then relate that to the population size. So you can see the incidence of the virus across the population, which is why I was talking about the number of cases per 100,000 people.
And there's been some kind of comment about the amount of testing that's been undertaken in the north compared to London. And the reduction in test facilities in London compared to the north. What's your understanding with that?
Well, basically, the test facilities are being used by the clinicians where they think they need them most. And they have been deployed into some of the higher peak areas. So in some parts of the country where the number of cases has been falling, I think they've removed some of the capacity and moved it to other areas. So I think it is a simple question of being driven by the science.
I think we're all, on the majority, trying to do our best. Mm-hmm. So I think there's been news items of particular areas where they've come under focus, and I think a lot of people kind of scratch their head a little bit and think, well, I'm doing what I'm told, I'm doing the best I can. So they're feeling a little bit sort of singled out, a bit to blame when they don't feel they should be blamed.
Well, I wouldn't be blaming people, I have to say. I don't think that's right. I think we have seen very good compliance. I think people have really wanted to do the right thing. They have known this is an important matter. This is the greatest public health emergency in 100 years, leading into the greatest economic emergency in a comparable timescale. So I think people actually have shown remarkably good compliance. And if you just look around our area, not only have we seen good compliance, we've seen at the height of the lockdown people take a real pace forward to try to help those around them. It could have been just informal, doing a bit of shopping for an elderly neighbour, or it could have been some of the more formal volunteering schemes. So I think actually we've seen some of the very best of our society during the course of the past few months. And it is certainly wrong for people to feel singled out, whatever, unless you're perhaps the MP who had the case and then still chose to travel up and down the country. In that particular case, I think criticism is more than fair.
So you sort of touched on the economic impact. Obviously, there was the furlough scheme, and that seems to be largely well regarded for what it has done. And I know you've been under pressure, particularly by other parties, about they want you to support an extension of the furlough scheme. Is that something that you'd want to do?
Well, I think you have to use the right scheme at the right time. And the furlough scheme was brought in when we were really at near total lockdown in the springtime. That's not where we are now. Shops were broadly closed. Most shops are now not closed. People were unable to work. Factories had been closed. So it was right at the time, but it is also right to evolve this scheme to the correct current circumstances. So no, a blanket extension is not appropriate, but a more targeted extension is appropriate, and that's where we've got to. And I think that's what we'll see over the course of the next few weeks as well.
Because that leads on to there's certainly some industries, aren't there, like the entertainment, nightlife industry, that are really struggling because they can't trade. So they're kind of feeling that the furlough scheme's ending, but at the time where they still kind of need a level of support. Do you have a thought on what should be provided for them, or if that's within the budgets of what could be provided?
Well, the hospitality sector has undoubtedly really been at the forefront of the different sectors which have been affected, no question about that. The Eat Out to Help Out scheme, which ran during August, certainly boosted one part of the hospitality sector, and that's come to an end. And that was a scheme really designed to boost people's confidence, to show that the hospitality sector has done good work in making themselves coronavirus secure. But we've seen a significant change in the data over the past few weeks, and particularly actually the last few days. So I think it is possible, looking at the projections, that we could see some restrictions in certain parts of the country. I hope we don't get to that point here. It is in all of our hands, really, to try to prevent the spread. We have the means to take responsibility and do all we can to help. In terms of the support, well, the support package that's gone in has been really quite comprehensive, and we've seen not just the furloughing scheme, we've also seen things like cuts in the VAT rate applicable to the hospitality sector. In terms of the future, I think what we've seen from the Chancellor only announced today, which is an extension for areas where they have a specific local lockdown, and those companies which are unable to trade because they have been closed will receive further financial support. So we've gone from a general blanket approach to a more targeted approach.
And do you think the government's got the right balance with the involvement of local authorities and the measures that they can apply themselves? I know there's a lot of discussion, particularly like Leeds City Council's been very vocal the last couple of days about wanting more feedback from the government and more involvement.
Yes, I saw some of the comments made, and I know obviously most of the council leaders in the north. I've spoken with the council leaders here on a weekly basis. In fact, all the MPs from North Yorkshire have, because we have a conference call on a Monday. So it's quite straightforward. So I think the contact that has been through national and local government has actually been quite good. Our local council leaders have not raised problems with me, and they've had every opportunity, which is the point I'm really trying to make. It is a mixture of local and national authorities working together. And it's not an easy thing to do, because we're seeing data changing quickly, and in those circumstances you can often feel that things are done to you rather than with you. Invariably it is much better for things to be done with you. So wherever possible, I think national government should be involving local government. But my experience here, talking to the leader of North Yorkshire County Council primarily, because they're the local resilience forum authority here, has been pretty good.
To continue the theme about sort of consultation, there's obviously, as you said, it's a fast-moving situation, and there's a need to move things forward. There's been kind of particularly that the COVID rules have come in largely without any consultation in the House of Commons, and they're due to be, is it right to say it's debated next week?
Well, we've been having a number of debates.
Yeah.
I think at the beginning there was a question of getting things done quickly. However, Parliament exists to protect the freedoms of British people, and we have seen restrictions on the freedoms of British people, and consequently Parliament should have had more of a say. I think that is reasonable. The government has certainly changed its policy to make sure that Parliament does have a say. We've had a significant number of statements all the way through the process, actually. So the Health Secretary has come to the dispatch box and answered questions probably 3 times a week, every week. That's been pretty good. However, that hasn't been followed through with a vote. And we've had one vote, we're going to have more votes, and there will be far more consultation. We've already seen briefings to members of Parliament, from the Chief Medical Officer, from other scientific advisors. Yesterday I participated in a Zoom conference with the Chief Medical Officer and other MPs from the North. So things are already changing. Was the balance right? No, I don't think it was. In fact, I said as much in a speech in the House. And I was pleased to see the government has therefore changed and there'll be far more involvement. You can't take civil liberties away from people, whatever the merit of your case, and it is a very good case, it's done with good motives here, but that still needs to have the proper parliamentary scrutiny and approval.
Turning the sort of clock back, obviously the country was on a much wider lockdown, and that had sort of knock-on effects with kind of mental health, particularly, seems to be a big theme, and we've got, I think, Mental Health Day tomorrow, I believe. And it was very difficult to kind of model all the impacts and effects on the country of measures that were going in. I know there's been kind of budgets assigned to certain areas, isn't there, like domestic abuse and mental health. Do you feel that that's kind of worked in the right way? It's
a real challenge, this, because it isn't a consequence-free decision. You make a decision to focus on coronavirus, and you close parts of the economy down, you restrict access into things like care homes to stop the spread of the virus. Again, a decision taken with good motives, but it has lots of consequences. And the consequences have been impacts on mental health, certainly, impacts on crime generally, impacts upon domestic abuse. So there have been all sorts of different ways that society has been influenced by these big decisions. And I think when it comes to making those big calls, you have to consider, if you're in government, you have to consider every single element of this, because it's not just one part of health that you're trying to protect, it's all of health. And the amount of time that people will put up with restrictions was also a consideration. You know, I know that because before Parliament broke and we went into lockdown, the Chief Medical Officer gave a presentation to MPs, all of us, and talked about how long British people would potentially put up with a serious lockdown without starting to see some of the compliance fraying around the edges. So I think it's been a consideration all the way through. It's a tough one as well because the issues you just mentioned aren't always visible, and consequently you need to be really very vigilant to make sure that they're getting the attention they deserve. But I am personally anxious that we see more effort going into mental health more broadly. That's been a concern for many years, and it's certainly one which is right at the fore at the moment when it's under real pressure because of the coronavirus pandemic.
So just to finish off then, I think we both said that things are changing very quickly. What do you feel that we can expect to see over the next week or 2 weeks? There's obviously talk about announcements next week over a new kind of tiered lockdown structure, but that's not been confirmed. What do you feel that we're going to see that will affect, say, Harrogate or the wider North Yorkshire region?
Well, we don't know yet what we're going to see, and it's partly because the data is changing, and it can change really fast. For example, the Craven Council area just next to us, the cases there doubled over the course of just one weekend. So this is data which is moving very quickly. We know that in parts of the northwest particularly, the number of cases per 100,000 is over 500. Here we're at only a fraction of that. So what happens here will depend upon the spread of the virus. Hopefully, because of the very high levels of compliance, we won't be seeing further lockdowns or any restrictions. But we just don't know. We can't tell that. All we can do is try to make sure that our public services are prepared, which they are. Well, I know that because of this. They're also part of this weekly conference call we've been having. But then each of us, as individuals, taking responsibility by doing all we can to make sure that we don't spread the virus, even if we're carrying it, wearing masks, washing hands, etc. So it is a tipping point. It is a moment when we know that the incidence is growing. We know that has, earlier in the year, led to hospitalisations and deaths. It's been a true tragedy for all the families concerned. We must do all we can, therefore, to avoid it. And we can do that. We can get through this with less grief and less problem, I think, if we can all do our bit and comply with the medical officer's instructions.